In this video, we will explore intermittent fasting, which is a simple yet effective method for weight loss. I will break it down into 5 steps, making it easy to understand and apply. Hey everyone, I'm Dr. Sethi. I'm a gastroenterologist and I focus on your gut health and nutrition. Many of my patients have found success with intermittent fasting, but why does it actually work? Let's look at our body's natural insulin cycle. When you wake up, your insulin levels rise and peak in the early afternoon, then decline after sunset. If you align your meals with this cycle, especially by stopping eating after sunset, you can experience significant weight loss. Eating outside of this cycle often leads to excess food being stored as fat. At nighttime, growth hormone steps in to repair your body, allowing insulin to recharge for the next day. This synchronization with your body's rhythm is a key to success. One major advantage is that you don't have to obsess over food quality at the beginning. While healthy eating speeds up the results, even if you indulge, your hormones can still benefit because of the overnight fasting period. Intermittent fasting is appealing to a lot of my patients due to its simplicity compared to other weight loss methods. The fasting window typically spans around 12 hours from sunset to sunrise, making it accessible to most people. To start, note your first and last bites of the day, whether it is your morning breakfast or a bedtime snack. Calculate the time between these to determine your daily eating window. During the fasting period, you can have water, black coffee, green tea, but avoid adding sugar, cream, or other extras. Step 2 involves gradually reducing your eating window to a minimum of 12 hours with a long-term goal of an 8-hour eating window. Third, consistency is key. It is better to maintain a 12-hour eating window every day for 30 days than sporadically using an 8-hour window for a few days here and there. Step 4, this addresses concerns about food quality. Initially, you do not have to obsess over the nutritional content of your meals. As the habit solidifies and you see progress, you will naturally lean towards healthier food options and minimize junk food. Final step is all about patience. Results can vary, with some seeing changes in as little as 3 weeks, while others may take a couple months. Consistency is a real secret here. Regarding medications, those are usually acceptable during intermittent fasting as long as you're taking those with water, but make sure to consult with your doctor as some medications need to be taken with food. Here is a summary. Intermittent fasting is a great method for weight loss, but it requires time and patience as you reshape long established habits. Follow this routine daily for 3 uninterrupted months for best results. Consider sharing this information with your friends and family who might benefit from a 12-hour eating window. Don't forget to show your support by liking, sharing, and subscribing. Thanks for watching.